Welcome to Disruption Dialogues Podcast Season 2. Listen to the influential leaders and trailblazers from around the world as they share invaluable insights to navigating the fifth industrial revolution.
Hello, and welcome to another episode of Disruption Dialogue Season 2. I'm Siddharth Saha, Senior Vice President with the Healthcare and Lifesciences Practice at MarketsandMarkets. And today I'm in conversation with Dr. Karin Munasinghe, Senior Director Marketing EMEA at Becton Dickinson's Integrated Diagnostic Solutions Group. The topic for today's discussion is maximizing the momentum of digital transformation to enable high-performing healthcare systems. And I'm excited to have Dr. Munasinghe, who brings a wealth of experience across geographic markets. We are well aware that healthcare systems and organizations around the world are facing a variety of challenges that hinder performance. This was exposed during the pandemic and it continues. Dr. Munasinghe, how would you describe and prioritize the most pressing challenges as you see it?
Okay, well, I think that the challenges pre-COVID have been and are very similar to what we see post-COVID, but I think COVID has accelerated some of the need to change as a result of this global pandemic that really impacted healthcare provision. And as a result of that, I think we've all learned from that. So I would say that most markets, whether they're developed markets or emerging markets, even have been suffering from a general challenge of how to keep providing sustainable value to the consumers, the patients, because the demands on healthcare services are growing exponentially, very much driven by an aging population, and a population that is also becoming more and more obese, which then has comorbidities such as diabetes, cardiovascular related diseases, all of which require more intensive, more frequent follow-up with healthcare services. So obviously, and the growth in some of these drivers is outstripping the growth of healthcare budgets that are available. So there's been always a little bit this squeeze, supply and demand of healthcare services, and I think what I at least have experienced during COVID is that obviously most of the governments had to spend way outside of their normal healthcare budgets, and as a result of that, coming now out of that situation, we see that the governments are in a huge deficit around their healthcare spending, and so they're looking now for ways of how to still provide sustainable healthcare services, but with less money to spend going forward because of this deficit that they now have as a result of COVID. I think some of the other things that are exacerbating also the provision of healthcare services post-COVID is that obviously around the world, the healthcare professionals went through a very intensive sort of 2-year period where they really had to work almost 24 hours, 7 days a week. And what we see across the board is that, the healthcare workers are exhausted, stressed, they've had burnout, and a lot of them are now leaving the profession as well. So most healthcare institutions are really finding it difficult to also find employees to actually work, in their hospitals, in their laboratories, GPs, whichever sector of the healthcare system. So this is definitely a unique situation. I mean, certainly in the past, I think, to train and to become a doctor was a very esteemed profession. And nowadays, I think a lot of doctors are getting out of the profession and are considering sort of lifestyle changes as a result of. So these are some of the challenges that are facing the healthcare system. Some of them have been exacerbated by but not all of them.
Yes, absolutely. And you highlighted quite a bit about the pressure on staff and burnout. You've touched upon the clinical experience, but I'm guessing your feeling is that this is compromising patient outcomes and ultimately clinical outcomes as well, and the ability to provide equitable healthcare.
Yeah, absolutely. I mean, if healthcare institutions aren't able to provide the level of service that's required, and of course the demand for services is increasing, right? But the healthcare services are finding it difficult to keep up with that demand on the supply side, right? This is where the constraints are, and I think that certainly post the healthcare systems, decision makers, stakeholders, whether it's government, whether it's medical professional bodies, regulatory authorities, they are, I think, a lot more open to looking at digital solutions to overcome some of these challenges that they're facing. And also because of both the healthcare professionals, the healthcare institutions, as well as the consumers, the patients, have been forced to use also digital solutions to some extent. And now coming out of COVID, we're all asking ourselves, well, actually, we quite enjoyed that experience, right? Why can't we continue with that in our normal state, right? So you're starting to see some of the barriers dropping in terms of adopting some digital solutions to overcome some of these healthcare services constraints, and obviously therefore provide a better patient experience as well. Because I mean, patients are saying, why do I need to now go to my GP if I can have a teleconsultation? If that was okay during the pandemic, I want to still have that same experience, right? It's an enhanced experience without the pressures of
Absolutely.
Yeah.
Absolutely. And Karin, the focus of today's discussion was that impact of digital transformation, and we are seeing a whole lot of innovative use cases on how systems, processes, workflows, and decision support can be improved. In your opinion, are there how's this directly resolving some of the challenges that you mentioned? You talked about capacity, burnout, extra work, frustrations, apart from the overall budget issue. Can you highlight some specific examples where you see it making a big impact?
Yeah, I mean, look, some of the areas, even prior to that, have already made great advances in terms of how digitalization can streamline certain diagnoses, workflows have already been well documented in various parts of the world. So in the field of radiology, for example, there's certainly plenty of examples where AI algorithms have been able to actually provide more accurate diagnostics of various radiology images, and you're starting to see now that these algorithms are being adopted by healthcare systems around the world. For example, just a couple of days ago, I was reading that in the UK, the NHS, together with the government, are looking now at introducing certain AI programs for some of their cancer screening initiatives to try and not only screen more of the population faster, but also to make sure that with their limited number of radiologists that they have, that the AI is able to perhaps do the initial screening and then make recommendations of where the radiologist, the human radiologist, still needs where a second opinion is required, right? So I think certainly these AI algorithms and digitalization is not going to, I know there's a lot of concern within the medical community about the fact that their jobs will be lost, but I don't think that that's the case at all. The problem is that we don't even have enough doctors, nurses, radiologists, and there's this constant increasing demand for their services. So I think all that these digital solutions are doing is to really allow the same number of medical professions to actually manage a much larger growing number of requests and workload,
Yes.
right?
Absolutely. And you touched upon productivity and decision support and productivity, but then productivity being the important point there. There is also this tremendous interest in alternate sites of care, and we are seeing some evidence in certain Western markets, the transition of care delivery moving into ambulatory settings or the home settings. It may not, it definitely will not remain within the four walls of a hospital. Do you see digital transformation actually accelerating that move into these alternate sites as well?
Absolutely. I mean, I think, what digital solutions offer is peace of mind and to the clinicians who still have legal responsibility for monitoring their patients if they are outside of the physical walls of the hospital. So, very often when I've spoken to doctors about some of their aversion towards treating patients remotely where there are digital monitoring solutions available, their main concern is, will I still be liable if the patient has some sort of a problem with the treatment when they're not actually in the hospital setting, right? So with a lot of these digital solutions, that risk is slowly being taken away. Especially if the software is also registered a software as a medical device. So now within the regulatory environment, there's the understanding that software can be providing decision-making recommendations to the clinicians, and so the level of regulatory hurdle for those types of software is much higher. And that's bringing then peace of mind to the doctors. So, for example, in the world of dialysis, there is a certain type of dialysis modality that can be now done at the home, and it's done during the nighttime. So the patient is actually sleeping, and that there's a machine that is automatically circulating dialysis fluid through the patient's body, and that monitoring is feeding directly back into a control center in the hospital. And the doctors can actually change some of the prescriptions. So if they see that the patient is not receiving the right dialysis dose, they can actually change the prescription remotely, and the machine will automatically adjust the prescription. So again, there's no need for the patient to come on a regular basis back into the hospital. So I think both from a patient experience perspective, that's a good thing. There's peace of mind also from the healthcare professionals' perspective that they're able to use the software to monitor and to also change some of the clinical prescription scope as well. So obviously that alleviates then the pressure for the hospitals to have patients constantly coming in for meetings with their doctors.
Absolutely, and that's a that's a great example you gave. We look forward to seeing many more such examples. And I guess when you start to quantify the benefits and you convert it into capacity increase or more patient throughput, satisfaction, and ultimately better outcomes at the healthcare system level, not just the institutional level. We wanted to spend a few minutes on stakeholder involvement. Clearly, this is not two parties or two individuals making decisions with regard to absorbing digital solutions.
Mm.
There's several personas that have a role to play in the decision-making structure to procure, use, justify, and each of these personas have their own motivations. Karin, you've spent time in Asia, uh, obviously in Europe as well.
Mhm.
So, what has been your experience, in the differences
Mhm.
across geographies when you think
Mm.
about these personas and their
Yeah,
willingness to
yeah,
adopt?
yeah. Um, so the interesting thing, both in the European context and also the Asia Pacific context, is that I've certainly not seen a specific trend in terms of, for example, developed markets adopting, this type of digital innovation more than emerging markets. Quite, actually sometimes the contrary. I think a lot depends on the strategic importance that digitalization in the healthcare system is on governments' agendas. It's also whether the ecosystem is set up so that it can partner with some of this innovation, whether it's technology startups or whether it's the medical device industry, partnering in a way that some of this innovation can also be evaluated in a real life hospital setting, and obviously also then the general trend in those economies towards digitalization, because obviously the consumer, the patient, has to also feel comfortable that if they're experiencing digitalization and a better experience with their banks and financial services, then that transition to also digitalization with their healthcare is a easier change management and mind shift to make as well, right?
Mm-hmm.
For example, China is a huge market, and it has I think it's called the China 2030 policy around making sure that the 1.3 billion people have by 2030 universal medical coverage, and that's driven on 4 key pillars to get to that stage. And one of those pillars is innovation and technology. So part of that universal coverage is very much dependent on the adoption of innovation in the Chinese healthcare setting, and in fact the adoption of a lot of the, especially also sort of digital solutions and AI solutions, is really has accelerated, and some say that it's on par with what we see in the US, for example. So for example, again, with radiology, one of the biggest provinces, Zhejiang province, has an AI and big data platform that is being used for colorectal cancer screening, which is the second most common cancer in India. And something like 4 million of that population have already gone through that digital screening process, which includes screening, diagnosis, and treatment, all facilitated through AI solutions and patient pathways. So obviously, that's one example of an emerging market. Then in terms of more advanced markets, here in Europe, for example, as I said, the UK and NHS has also an accelerator. So the ecosystem is there where the NHS has an accelerator to promote startups, to work together with them to bring in some of this digital innovation into the NHS, into the clinical setting, right? So that it's not just a theoretical concept, but it's actually taken and proven in a clinical setting. So there are plenty of examples across Europe and in Asia where different markets are adopting digitalization, AI solutions in healthcare at different paces, right?
Yes.
Yeah.
The couple of examples you gave in the NHS and in China, it kind of highlighted the push, the top-down push, right? The policy is progressive, encouraging, and then clinicians and stakeholders automatically start to embrace that. But do you think down at the user level, at the customer level, there exists a difference in behavior and willingness to adopt and use? Have you seen that difference in your experience between Asia and Europe?
No, and I think actually the biggest differentiator at or the driver of adoption at the grassroots level is actually more generational gap, right?
Mm-hmm.
I have seen the older generation as C-suite hospital decision makers, not being comfortable with adopting a lot of these digital solutions, where some of their more junior consultants are very eager to try out some of these digital solutions. It's the same also at the consumer and the patient side. I think we've probably all experienced this scenario where our elderly parents are needing to go to the hospital, and we as the younger generation are doing the Google searches to first check out what exactly the diagnosis could be, so that we go into the hospital already ready and armed with some information, right? So what I see very clearly happening is that as the younger generation that's been already influenced by digitalization in every sphere of their life, as they start to go into these very important government, healthcare institution decision-making roles, I think they will be the ones that will be also pulling a lot more some of these solutions at a faster pace than perhaps some of the older generation that are currently sort of influencing and these key decision makers.
Interesting observation. Yes. And do you think the supplier community, the solution providers, should take distinct different approaches in these two markets, because of these because of the difference in the change of or speed of change and the willingness to adopt?
I think again, each market is in such a different stage of regulatory readiness, governmental policy, proactively fostering the adoption of digital solutions, that I think you need to look at market by market to see what is how to position yourself, with your digital solutions. I mean, in Europe, there's certainly markets that I think the medtech industry would probably want to go with new solutions into those markets first, knowing that the barriers are lower, right? And the same also in Asia. There's some markets that already have the regulatory environment in place to be able to assess, relatively quickly whether or not an AI solution can be used in a clinical setting, or whether a software can be deemed software as a medical device, right? They have very clear guidelines also for the suppliers to know what studies, what validation needs to be done to show efficacy and safety of these software as a medical device, right? So I think it varies from country to country.
So clearly, a one-size-fits-all approach will not work. It has to be very specific to the territory as such. So we can't end this discussion without touching upon the regulatory and governance mandates that are becoming important. So how would you describe the risk of adopting digital technologies, including artificial intelligence in healthcare industry, which is highly regulated, do you think the opportunities surpass the risks, or there's what's your take on?
I think the regulatory environment and the regulation around adoption, adoption of digitalization in a clinical setting, and then also, AI and machine learning types of algorithms, it's always a little bit behind the rate at which the innovation is going. And I think there will always be sort of catch up from a regulatory perspective. But certainly what we're seeing in Europe and across Asia is that governments have realized that, and I think very much accelerated also by, have realized that there are so many digital solutions available that can really help with the overall productivity and output of healthcare systems, that they can't ignore it. And so definitely, the regulation is there. For example, Germany, which is one could consider still sort of more on the conservative side in terms of general adoption of digital solutions. Even the German government now they've introduced a few years ago a new reimbursement for digital solutions, so long as those digital solutions have been tested out in a clinical environment, evidence is there to show effectiveness. And the reimbursement is also now available for some of these digital applications in the German market, right? In Asia, where still many of the emerging markets in particular, patients are paying out of their pocket. So they're the ones that are deciding, I'm willing to pay for this digital solution because it brings me a better experience. I can access remotely doctors that I may not be able to normally access. So definitely, I think digitalization is democratizing also healthcare provision. And there are risks. For example, in Singapore, Sing Health, the Ministry of Health there has had for quite many years a very targeted approach around making all of their hospitals paperless. And as a result of sort of digitalizing their whole healthcare system, there was also recently a hack into their cloud storage systems, and they were able to extract patient data, including also the data from the Singaporean Premier. So that obviously blew up in the papers, and then there was a bit of soul searching that took place, and the Premier certainly said, look, I don't mind people knowing that, at the age of, I think he was 70 or something like that, that yes, I have a few illnesses and I'm taking medication, but I'm still not going to prevent that type of a cybersecurity risk from advancing our strategy around digitalization, right? So I think it's always about risks and returns, but I think the returns have clearly been shown through COVID as well, yes, that they outweigh the risks, and we continue going forward on this very exciting path.
Absolutely. I mean, that was a great example of a statesman taking that stand, leading from the front. So you do concur that the opportunities surpass the risks overall.
Absolutely. And you see that as more and more countries are adopting digital solutions, putting the regulations in place, even like in this case of Germany, having reimbursement, so that if a doctor is prescribing an application, a digital app, there is reimbursement as well for that, right? So there's so many examples that it's the train that has left the station, and now it's just made a question of how quickly will it get to its end destination. It's not whether or not it should start moving forward. That's already happened. And the trains are just moving at different paces at the moment.
That's great to hear. So on that positive note, I would like to thank Dr. Karin Munasinghe for spending time with us on this disruption dialogue. Thank you, Karin, for such an interesting discussion. Thank you, everyone, for listening in. I was in conversation with Dr. Karin Munasinghe, Senior Marketing Director, EMEA, at Becton Dickinson's Integrated Diagnostics Solutions Group. Thank you, Karin, once again. Stay tuned for such interesting episodes on the Disruption Dialogue series. Thank you.
Thanks for tuning in. If you want to know how you can navigate and thrive in this disruptive era, subscribe to Disruption Dialogues on your go-to podcast channels and stay tuned for more interesting episodes.